Hey everyone, D&G here. I hope you're all doing well. As mentioned in one of my previous posts about chronic invisible illnesses, the month of June is APS Awareness Month, and tomorrow, June 9th, happens to be World APS Day. Yeah. So be sure to wear some burgundy. So today I thought I would change things up a little bit, hence this video, and tell you a little bit about APS and what it's been like for me living with it the past 10 years. I hope you'll forgive the attire. It's been a long day. I'm not feeling that great, so pushing through. APS stands for Antiphospholipid Antibody Syndrome, which besides being a mouthful, is a disorder where your immune system attacks the normal proteins in your blood, which is a little bit like how lupus works, except it specifically attacks the blood and the proteins in it, which, if you haven't noticed, your blood kind of goes everywhere and is pretty important. So when something goes wrong with that, it can cause some issues. Some of the clinical features of APS include blood clots in veins or arteries, strokes, transient ischemic attacks or TIAs, sometimes called mini strokes, miscarriages, preeclampsia, heart attacks, decreased platelets, heart valve problems, skin ulcers, livedo reticularis. I'm sorry if I butchered that. I personally haven't had an issue with that. And also catastrophic APS, which is categorized by multi-organ issues in a very short period of time. Obviously dangerous, lots of problems, hence the term catastrophic in there. So besides those clinical issues, the people with APS also often deal with migraines and headaches of Exhibit A. I actually have one that is growing as we speak, so I plan to take a very long rest after I'm done with this. Also fatigue, again, big one over here. Sleep disturbances, concentration issues, and brain fog, which is a feeling of memory loss, difficulty thinking, confusion, not being able to think clearly. It's not very fun. So diagnosis of APS is generally from blood tests. Blood tests are done, and this is often in combination oftentimes with clinical manifestations such as blood clots, such as was my case, but really it comes down to blood tests. Some other interesting statistics for you about APS are that APS affects 1 to 5% of the general population, and to give you some context, natural redheads make up about 1 to 2% of the general population, so stick that feather in your cap. Also, 10 to 25% of women with recurrent miscarriages have APS, which is a rather, sizable percentage. APS can affect anybody, any age, race, gender, ethnicity, doesn't matter. But it is a major women's health issue in that that 75 to 90% of the people that it affects are women. Go us! Another interesting note is that 40 to 50% of people with lupus also have APS. Again, Exhibit A. So, treatment of APS, there is no cure. There is only treatment really to prevent more blood clots happening in the future, which is done through anticoagulants. Some people may have elevated antiphospholipid antibodies, but not have any clinical manifestations such as blood clots. This is true for mainly like my sister and my mother, because they both have the antibodies, but they thankfully haven't had many, if any, issues dealing with blood clots. So the most common form of anticoagulant is warfarin or Coumadin. Those are kind of interchangeable names, so I apologize if I switch back and forth. It actually was originally used as rat poison, I believe, so sometimes I just say taking my daily dose of rat poison. But other than that, the other approved versions are injectables such as Lovenox or Hepburn. As of now, there are no new anticoagulants on the market that have been approved specifically to treat APS. Some drugs like Xarelto that are new have been prescribed to me or suggested to me by doctors, and it's still relatively new on the market, and it's not technically approved to treat APS. So I personally will stay away from those. Another kind of interesting thing to note is that A study is being done to formally answer the question of whether or not these some of the newer drugs are should be approved to treat APS, but the APS Foundation of America notes that many people have reported clotting on some of these newer anticoagulants. So always, you got to make the best decision for yourself, do the research, that kind of thing. That's most of the hard facts concerning APS. And at this point, I just figured I'd tell you a little bit about my personal experience and what it's been like living with APS. I was 17 and I got a phone call and was rushed to the hospital because I had a blood clot in my lung, a pulmonary embolism, which sounds scary enough until the doctor walks in and tells you, we usually catch these in the autopsy because we don't know why the patient died. Pretty heavy news to take at 17 years old, I will say. As a random side note though, I got to see the CT scan later on in the doctor's office and it looked so freaking cool, even though, it was a very, very bad picture that I was looking at. It really was some. I could see, one lung was completely white, the other was completely black. I want them both black because it's clear. I really would have hung that up over my wall if I could have, but anyway, moving on. That diagnosis and that pulmonary embolism changed a lot about my trajectory in life, and even if I was too stubborn to admit it, which I definitely was at the time, for the first 5 months or so after that, I had to use injectables. So the Lovenox is what I used for my blood thinner, and I had one of those. I had a shot every 12 hours for 5 months. Which is really difficult, and these aren't insulin sized needles. They're quite a bit heftier and much more uncomfortable, I would imagine. My mother helped me with those so that I didn't have to continue injecting myself in my calves. She would inject me in the backs of my arms. Sometimes she cried, sometimes I cried, sometimes we both cried. Either way, it was a very difficult experience. And not one I really would recommend. Eventually I was placed on warfarin. This is after I turned 18 and was a few months after that. The thing with Coumadin is that it's tricky to keep the levels right. You have to go in at least once a month to have an INR check to make sure you're at the right level. And you have to be careful when you take Coumadin for cuts, bruises, scratches, falls, knocks to the head, anything like that, because it can be really dangerous when you've got a blood thinner. Taking Coumadin also limits other medicines you can take, and because it's a blood thinner, anything that has something like aspirin as a base in it, I can't have because that's a double blood thinner. It can cause a lot of issues. So the other thing it affects is your diet. Thankfully for me, it hasn't been too big of an issue because I never was much of a drinker, and I don't drink anymore at all. But diet in general, I swear, only on Coumadin will a doctor tell you lay off the salads and the green leafy vegetables. Green leafy vegetables have a lot of vitamin K in it, and that reduces the potency of Coumadin. So when you take Coumadin, you have to kind of be careful how many green leafy vegetables you eat. I just find it's pretty funny. I was initially told to take at least a semester off from college. I was starting college. It was literally less than a month before I was due to start after getting out of the hospital, if not the year off, but between insurance issues and my own pure stubbornness, I'm sure, I kept going on a full course load, and it did not go well. It was way too much for me. The fatigue, my body was still healing, I was just exhausted, I couldn't think clearly, and I didn't do nearly as well as I could have, which obviously affected me later on. As I've mentioned, dealing with fatigue, I also deal a lot with migraines and headaches, which is really not fun when you have complex or complicated migraines, because those can feel or exhibit like TIAs or strokes, which is incredibly terrifying. So sometimes I have to make a judgment call on whether I wait it out on my couch or if I go to the ER. No one will tell you to ever wait it out on the couch. They'll always tell you if you have such and such symptoms, go to the ER. However, when you've been to the ER as many times as I have for the same issues, you learn that sometimes you really just have to make a judgment call. It's not a fun part of it at all. I don't really like that part, but it's part of my life, and it's always a dice roll. You know, I'll flip of the coin to see what I end up doing and what I need to do in order to do what's best for my body. Brain fog is another thing that I deal with. Obviously right now, between the migraine I have, it's really not helping. So I apologize if I'm starting to get a little scattered here. But I do remember one time, brain fog in general was one of the scariest times was I couldn't remember where I was driving. I remembered how to drive, obviously. I was driving very safely, but I couldn't remember where I was going. I couldn't remember my mother's name. I didn't know anybody's phone number, and I couldn't remember where I lived. Not fun feeling, not at all. It's a lot of not fun with this. But thankfully that's not, you know, such a huge issue to that degree that often, but it is a part of what I deal with. On that note, over the past 10 years, I've also had to deal with miscarriage and pregnancy issues. I don't really want to get too much into that. A lot of that really is still very personal and it's just hard to talk about. So I'd really rather not get into some of the details, but in 2008, I was suffering from preeclampsia. I was pregnant and I was very, very sick, and I was in the hospital, and they were monitoring me, and my blood pressure was through the roof. I was not doing very well. There was more complications like every moment, and then the baby died, and then I almost died, and only really thanks to some very skilled, amazing doctors, I obviously am still here. Pregnancy in APS is high risk, no matter which way you dice it. They suggest you have a specialty in high-risk pregnancies if you have APS and want to have baby. Combine that with me personally having lupus, which is also a high risk for pregnancy. It was really a perfect storm, and I got to live out that scenario. Later that same year, I had 6 TIAs, 6 transient ischemic attacks, also called mini strokes. I'll never forget the first one in particular. I was talking to my boyfriend at the time on the phone. I was having a rough day, and I had this headache, and I was talking to him. I was walking around my kitchen, and I put my weight on my left leg, and then I felt this trickling down my left side, and all of a sudden, smack, right into the floor. I fell. I couldn't feel anything on my left side, and I was telling him this, and he's like, call 911. I remember thinking, what's the number? I was very confused and scary and frustrating. I also had to crawl across the kitchen floor to open the door for the paramedics to come in so they could come get me. CT scan and MRI scans later confirmed that I had 6 blood clots in my brain over like a 2-week span. The other TIAs that I experienced were not nearly as profoundly felt, but I still noticed a difference in my left side, and it was very difficult to deal with, and it's a lot in a year. Something else I want to mention that comes along with APS is depression and anxiety. I mean, at 17, I learned that pain in my lung can be a pulmonary embolism. So from then on, pains in my side, my legs, my head, it was always that, oh my gosh, is this a blood clot? And there's a lot of anxiety that goes with that, and it changes a lot about how you see the world. Now, the anxiety side, specifically for me, a lot of that is also rooted in PTSD, which is a different story entirely. But depression is obviously a big, big part and goes along with APS because, you know, when you're dealing with things like brain fog, fatigue, headaches, just pain in general, you're gonna deal with depression because your life is altered from that. It's frustrating, it's debilitating, you feel helpless, you feel embarrassed, and there's a lot that goes to it, and the depression anxiety part of it needs to be addressed when it comes to those dealing with APS, particularly those who've dealt with it from a younger age, like myself. I mean, like when it first happened, it was like unheard of to so many doctors that someone so young had a blood clot like I did. We need more focus on what that means for people who are living with APS, and we need people to focus on that so that the research follows with that. Now, we say that we aren't our illnesses, we aren't our diseases, but it's important to note where there are these huge changes, because it does affect a huge part of your lives going forward, not just when you're in the hospital bed. And I don't think enough about APS is understood by most people, like to know that it's a day-to-day thing and not just when you're in the hospital getting over a blood clot or some other, catastrophic event. On that note, I want more people to learn about APS, and the more people that know about APS, the better, both for themselves as well as their family, and they know the signs and symptoms and what that means. We need more research done, and we need to have more solutions than are currently offered to those as far as treating APS and the issues that come with it. I hope you'll please check out the APSFA, the APS Foundation of America website, as well as some of the other links that I'll include in this post. And I just wanted to let you know, thank you very much for watching this video. I hope you've learned a little bit. I'm sorry if I've rambled and kind of lost my train of thought a little bit there. But thank you again so much for watching this. I hope you have a really amazing day. Take care.